and welcome to another episode of Ask the Doc. I'm your host, Jennifer Filzen, and today I have with me Uri Neeman of RealizeMD. Welcome, Uri.
Thank you. Thank you for hosting me.
Of course. Tell us about what you're doing at RealizeMD.
Perfect. So, Jennifer, RealizeMD is an AI-driven medical visual data platform that enables privacy-preserving visualization, allowing clinics to use all their before and after visuals of reconstructive and cosmetic surgical procedures while safeguarding patients' privacy. You see, the healthcare AI revolution actually skipped plastic surgery, medical aesthetics, even dentistry, anything that is visual medicine, preventing data analysis and predictive abilities as used in other medical fields. As a good example, Israel, during the past 2 years, shared with Pfizer data of all its population. They were able to do that because they were able to remove my identity, my ID, my phone number, anything that could identify me and therefore share the medical information. In visual medicine, the results are your visuals. And since most people will not give consent using their actual facial results, the industry is lacking tremendous amount of data for candidates to actually take an informed decision, lowering the trust in this field.
Wow. Wow. I'm glad you're sharing that information with us. So now, how did you get started in this?
Well, Jennifer, actually, it's a sad story, starting sad, but hopefully having a good end into it. So a sad family experience that I had that resulted in a death of a family member as a result of breast cancer. And due to lack of visual data to make a life-saving informed decision had led me to research the problem with an old friend of mine, Alon, who actually founded Allergan Israel. And he seconded me to this problem of visual data, lack of visual data. We then added Dr. Rappaport, a famous plastic surgeon of New York City, and to validate this need. And we went on a quest to study this problem across 3 continents, to find out there's actually true need that has yet to be addressed successfully. We then added our 4th founder, Stas, a mathematician, and he was a co-founder of several successful Silicon Valley startups, to lead the development of our IP.
Wow. Okay. I'm so sorry for your loss, but isn't it amazing how sometimes our worst, darkest times are a catalyst for something beautiful and good? And look at the beautiful things that you're doing, changing lives for the better with your service. Is it a service? Is it a product? Is it something that the average person can get access to, or is this primarily marketed toward doctors?
So we're starting by marketing to doctors, enabling them actually to liberate highly regulated medical visual data. See, each clinic, each physician sits on average on hundreds of thousands of images. And this industry, visual medicine industry, they would like to share, to have bragging rights on their results, and they're not able to do so. So they're left with the capability of doing either blackening of the eye or pixelating of the eye to try to move the identity. But Jennifer, if I take you as an example, and I put black lines or black circles over your eyes, you will recognize yourself. And someone who knows you will actually recognize you as well. So it's a gray area under HIPAA, which mandates that neither the subject nor someone who knows him is able to identify them. And the industry is simply left with occluded areas. So I can occlude the eyes, the nose, the mouth, but it doesn't give you a sense of the feeling of what an actual result is, a true result can be.
Oh, you're so right. You're so right. And for example, when we spend all this money on Invisalign, we want people to see it. Yes.
So when we market it to the clinics themselves will now be able to actually use it to help their patients, their candidates, better understand what results can seem like. They'll be able to see people like them, because the first question asked at any physician is, doctor, can you show me someone like me? Because if, Jennifer, you see a result on me, you may say, wow, beautiful result on Uri, but I want to see Jennifer-like results. So the ability to show you, to find through the massive database of the clinic results that you could actually share by transforming them into synthesized usable data, preserving 100% of the actual treatment, allows now for its use and to share. And by using this, we can now also help you simulate what a result would look on you as a patient. When we'll have those in place in thousands, tens of thousands of clinics, we'll now be able also to enable patients to experience and the education at a centralized site and be referred to all those clinics based not on who pays me more for me to place them in the system, but who has the highest probability of actually reaching the desired result.
Fantastic. Well, thank you so very much for joining me today, Uri. You are amazing. And everybody, if you want to find out more about what good work he's doing at RealizeMD, please go to BuzzTV at iwantabuzz.com. And thank you so much for tuning in. We'll see you next time. Bye-bye.